Communication Policy Officer for the NGO Tearfund. And together with PATH, we've produced this report entitled Diarrhoea Dialogues, From Policies to Progress, that investigates both the challenges and the opportunities facing effective control of diarrhoea in sub-Saharan Africa. And it's also it's available at the back there and also on this link that you can see here. Now, I will just start off by giving a very brief overview of the issue. Diarrhoea is one of the top 3 killers of children in sub-Saharan Africa and also globally. And 88% of these cases are caused by poor water, sanitation and hygiene. As we saw in the presentation before, Ashao did a great job of breaking down the individual impacts of water, sanitation and hygiene. And diarrhoea also contributes to undernutrition, which is also something we've heard about in these presentations, which is the underlying cause in about 3.5 million under-5 deaths each year. And more than half of all mortality associated with undernutrition is attributable to diarrhoea and worm infections caused by poor sanitation. And it's like a vicious cycle as well, because then undernutrition also leads back to diarrhoea and also pneumonia. And undernutrition causes weakness and fatigue, it inhibits mental and physical development, particularly in children, which also causes stunting. But in 2009, UNICEF and the World Health Organization issued global guidance in the form of a comprehensive 7-point plan to address diarrhoea that focused on both the treatment, the oral rehydration treatment and solution and zinc treatment, and prevention of rotavirus vaccines and exclusive breastfeeding, hand washing, water and sanitation. And Dr. Margaret Chan, the Director General of the World Health Organization, states, "We know where children are dying of diarrhoea. We know what must be done to prevent those deaths. We must work with governments and partners to put this 7-point plan into action." And now, despite its significant health burden, diarrhoea remains a low political priority. And unlike other health issues, ownership of diarrhoea control is often spread across the different governments and ministries, and it often gets lost. There's often no institutional home or accountability structure or responsibility for this. And I'd be really interested to know your thoughts about this issue at the end. And Kenya is the only country in sub-Saharan Africa to have a comprehensive policy on diarrhoea control that follows this 7-point plan. And although it's early days yet, there have been some promising results in a pilot study, and you can read more about this in the report. I can't go into too much detail now. But I will now just give an overview of the research that we did. We investigated how 3 countries are addressing diarrhoea. In Mali and Ethiopia, where diarrhoea is a leading cause of death in children under 5, and in Zambia, where the burden is also high. And this is according to the World Health Organization statistics 2011. Now, qualitative reviews took place in all 3 countries and were conducted by Loughborough University, and the 7-point plan was used as a tool to assess diarrhoea control approaches used in each country. And more than 100 stakeholders were interviewed and included representatives from national government, line ministries, donors, implementation agencies, to name a few. And this is no means an exhaustive list, neither in the report and especially not in this brief presentation, given the breadth and diversity of the different areas of diarrhoea control. And this report mainly focuses on the role of government in the form of policies and strategies, so of course we recognise that development agencies play a key role. And I know that our interest here is in WASH, and that is where our passion is, but I think it's also really important with diarrhoea control just to see how it also fits in with the health side and the treatment end. And I'm just now going to give a really brief top-line opportunities and challenges from each country, followed then by the overall lessons learned. And I'll start with Mali, though of course, unfortunately, since this research was done, the political situation has sadly changed. But one of the key opportunities we found during the review in Mali is that it does actually have a specific plan that mentions specifically diarrhoea control, running from 2011 to 2015. Although it doesn't just focus on the prevention side, and it doesn't bring in the treatment delays in its implementation and no accountability mechanisms in place at the moment. But it is there, and there are other opportunities, including the fact that the Ministry of Environment and Sanitation has just formed a new directorate with specific responsibility for sanitation, and CLTS is also being scaled up. But there are challenges. The percentage of children receiving rehydration treatment is low at 24%, and there's low access to clean water and sanitation, with the JMP figures in 2012 placing improved sanitation at just 14% in rural areas. Now I'll move on to Zambia. What's significant about Zambia is the percentage of children receiving rehydration treatment is high at 67%. And distribution of a rotavirus vaccine is currently being piloted in the capital in advance of a national rollout for 2013. And community health workers are delivering key WASH messages in communities. But as with many developing countries, incomplete decentralisation compromises the effectiveness of local authorities in both the health and the WASH sectors. And another key challenge that emerged was, again faced by many countries, is the limited reach into rural communities by community health workers. And moving on to our final case study, Ethiopia. One of the key opportunities found for diarrhoea control in Ethiopia is the famous health extension programme, through which health extension workers communicate at least 5 messages around diarrhoea control, and 3 of these include water, sanitation and hygiene. And there's also increased coordination between the different ministries, and a memorandum of understanding now exists between the Federal Ministry of Health, Ministry of Water and Energy and Ministry of Education to increase cooperation and coordination in the delivery of WASH services. And this has paved the way for the innovative WASH strategies, many of which we've heard throughout this week, including the WASH implementation framework and the National WASH Inventory, which will provide new data. However, Ethiopia again also faces many challenges with diarrhoea control, and it's in one of the top 5 countries in the world for childhood deaths from diarrhoea. And a key challenge, like Mali, is the low access to water and sanitation in rural areas. And also, while there are key strategies in place, implementation can prove a challenge, and low uptake of rehydration solution at 32% is one of them. And a key reason given was the low awareness in communities to go and seek this. So I guess overall, if you are comparing countries, Zambia does have higher access to sanitation and or rehydration treatment, and overall less percentage of deaths by diarrhoea, though more research would be done to establish the exact reasons for that. But now I'll very briefly talk about the overall lessons learned from these case studies. And one of the broader themes in all the countries I reviewed, as I just said, is that there are policies in place that enable communities to receive critical messages about diarrhoea control. And rather than just focusing on the curative interventions, health workers are delivering preventative WASH messages. And we also found in the 3 countries that there's evidence of strengthened coordination between the health, WASH and education sectors, especially with a focus on the links between health and water and sanitation and hygiene. However, there are also significant challenges in all the countries, and I suppose the first is the barriers to communities accessing both the treatment interventions and the preventive interventions. And though there are promising policies in place, implementing them is challenging, and access to oral rehydration solution is a challenge, and lack of community awareness for that is a challenge. And access to water and sanitation is a key challenge. And of course, the lack of clean water will have an adverse effect on the efficiency of all rehydration solution. And throughout this review, it became apparent that there are different behaviour strategies that are carried out by the Ministry of Health through community health workers delivering messages of water and sanitation. And then there's strategies like CLTS, and they're all talking about behaviour change, but perhaps there should be some sort of coordination to make sure that from the community's perspective, from the caregiver's perspective, they're receiving complementary messages and support as they transition through to to longer-term behaviour change as a result of either or both these strategies, and also to make sure that the resources being put into behaviour change strategies are used most effectively by governments. And in addition, the only international guidance for diarrhoea control is the UNICEF and WHO 7-point plan, and it became quite apparent that these guidelines aren't particularly well known, and so we really do have, the international community really does have a role to play here. And considering, I guess this is the overall message, considering the high impact of diarrhoea as a health burden, there needs to be some sort of coordination mechanism established between the health and wash sectors from the national down to the local level to make sure that diarrhoea control doesn't get lost and that there is a sense of responsibility for it, and there is coordination between the treatment and prevention. Because lack of coordination can mean that significant gaps in policies can be overlooked and barriers to implementation neglected, and the important opportunities, just like some of these that we've scratched the surface on during this report, can be missed if they can't be built upon. I guess the overall thing is that diarrhoea is preventable and death from diarrhoea is preventable, and yet one child still dies from diarrhoea about every 20 seconds. And so in the report we make these recommendations, and I would really love to hear people's feedback about these. We say that the international community should use its influence to draw attention to diarrhoea and catalyse political will in countries where the burden is high. The international community, including donors and particularly UNICEF and the World Health Organization, should encourage the promotion and guidelines that they came up with in the 7-point plan. We say the government should undertake a review of all existing policies and strategies that incorporate some elements of diarrhoea control at a country level. And those responsible for water and sanitation should urge the Ministry of Health to coordinate a comprehensive review of the policies that relate to diarrhoea control and bring together the preventive and the treatment. And government should develop some sort of national coordinating framework for diarrhoea control. Following on from the review that we suggest, some sort of coordinating framework should be established that outline the responsibilities of the diarrhoea control stakeholders with accountability mechanisms in place. And this could take a form of a policy like in Kenya, but overall it's obviously up to each country to decide and see what would fit in best. And perhaps specific areas of coordination and implementation from this review are as follows. Increasing access to sanitation needs to be a greater priority, and community health workers we found need to be better supported to carry out their role. Coordination between behaviour change strategies needs to be strengthened, and the treatment, the ORS and zinc and rotavirus coverage needs to increase. So this brings me to the end of presenting this research. As I said, the reports are available at the back and also on this link online, and I'd be really interested to hear from you, either after this session or via email, your thoughts and your feedback of the findings that I've presented this afternoon. Thank you very much.
Thank you, Stephanie, for your very passionate presentation, which brought the message out very clearly.